Next up, Mr. Grant Huang from Decision Health. He's going to be briefing us on some pretty cool apps that are out there on the provider front. Grant?
Thanks. My name is Grant Huang, and I work for Decision Health, and we are an information services and publishing company, and we are servicing the provider space in the industry. And I'd like to talk to you about fee-calc and the problem that we saw that needed to be addressed within the provider community. So it may shock you or may not that physician practices are not the best run businesses in the world. Doctors are very well trained in this country, but they are very focused on the clinical aspects of treating patients and staying on top of new developments and everything like that. And unfortunately, the people that pay doctors have gotten very sophisticated in their data collection and in how they use that data when it comes to paying providers. So the Blue Cross Blue Shields, the Aetnas of the world, they have very sophisticated analytics, and they're able to go to doctors and basically offer contracts that are very favorable to payers and not necessarily to providers. And unfortunately, when you talk to physician practices, independent physician practices that don't have all the resources in the world, don't have a whole staff of MBAs to be doing these contract negotiations, you find that they're very much stuck in the old ways of doing business, which is a lot of guesswork, a lot of word of mouth, a lot of, hey, we've always done things this way, and a lot of business decisions that are not based on actual data and metrics. So right now there are three absolutely critical questions that practices have to answer with respect to how they get paid. And I've talked to a lot of practices, and right now there's the most common answer is a bad one. I'll just run through these questions real quick. The first question is, if you're a practice, how do you decide how much money you charge for your services? And very often it's, well, just guessing at the end of the day. We want to make sure we charge way more than Medicare, but after that, it's often sort of a number just out of the blue, it seems, and that's not a good answer. The second question is, well, if you're going to base your payments on Medicare, how do you find out how much Medicare is charging for any given service in your area? And it's a complicated question because Medicare reimburses physicians differently based on where they're located, based on the type of service, based on so many variables. So a lot of practices, what they do is they go out to up to a dozen different government and contractor websites, and they download a ton of different spreadsheets, and they have to reconcile these spreadsheets to figure out just how much Medicare is going to pay to use as a baseline when they start a negotiation with a private payer. Okay, so finally, when it comes time to actually negotiate a contract, how do these negotiations actually go down? I mean, it's quite shocking, but the most common response is, well, we sort of just take what's offered. We can't really say, it's not reasonable because, we don't like it, it doesn't sound like a lot of money. So very often it's not a negotiation at all because practices don't feel like they have a really good argument to hit back with. So what we felt providers really needed was a way to look up Medicare fees without going to the hassle of hunting down spreadsheets from a dozen websites anytime Medicare changed how much it was going to reimburse. What they needed was a source of impartial charge data so they could see in their neighborhood what the going rate is for a colonoscopy or a skin biopsy or just a regular old office visit. And finally, what they need is a single, 21st century solution that's aware of this thing called the internet that actually is going to save them time when they're doing all this. Because let's not forget, they do have to see patients and deal with very complex regulatory environment and all the rest. So our solution is called fee-calc. This is actually the homepage of fee-calc. So you can see that this is a browser-based software. It's just point and click. On the left, you enter your codes for whatever services that your practice provides, and you pick the Medicare payment localities that are relevant to you, and you just hit search. This may seem like a wall of text, but what this is for a certain number of medical procedures that are on the left, the Medicare payments for those procedures, and in this case, in the District of Columbia, DC payment locality for Medicare. So they can see immediately at a glance what Medicare is going to pay for all these various different services wherever they may be located, and if they have different office locations in other localities as well. They can also see, using the search, the prevailing charges by zip area. I took the liberty of looking up the Barking Dog zip code, which is 20814. That's in the 208 GeoZip. So we can see that if you were to get a diagnostic colonoscopy somewhere around here, that the 50th percentile, perhaps that's the average, for a diagnostic colonoscopy around here, that the charge is going to be $743. And that would be your out-of-pocket payment amount if you were completely uninsured, and you had no insurance, no benefits, no nothing. It started at $743. That's what a doctor would be entitled to charge you. Now, if you had out-of-network benefits, the Aetna or Blue Cross Blue Shield would be taking a percentage off of that. If you had, if you were actually insured, there'd be co-insurance to pick up that. But if you're the doctor and you are trying to make money off diagnostic colonoscopies, you need to know where you want to start. You need to know where you are, right? You need to know if my fee for a skin biopsy is in the 25th percentile, I'm leaving money on the table. I'm not going to keep my doors open. At the end of the day, it's really not good for anybody. Certainly not the consumer who's got a relationship with his neighborhood doctor, and now that doctor may have to close his doors or align with the hospital or whatever the case may be. But this data is absolutely critical when you're talking about how doctors get paid, and unfortunately, very few practices have access to it. You'd be surprised the range in payment for very common services like a diagnostic colonoscopy or just a regular office visit. These are 3 different payment localities: rural Kansas, Bethesda, downtown Manhattan. You can see that the charges vary very widely. And again, if you're the doctor, if you're the practice, if you're the person setting the fee, without this kind of data, you're completely in the dark and at literally the mercy of any commercial payer who wants to offer you a rate that may or may not be reasonable. So again, the solution is a software-based, web-based solution. It's constantly updated. You don't need any software. It runs, just in your browser, and it levels the playing field between physicians and insurance plans, so that when practices make business decisions, they're doing it based on actual data. So I'd like to end with how people who use PeakHealth, what kind of answers they could offer to those 3 questions that I started with. So when it comes to the question of how do you decide how much you charge, well, you can say we use a database of 1 billion claims that represents 70% of all commercial claims billed annually, and based on that, we know that we're at the 85th percentile, say, or that we're at the 60th percentile, and that we're not just sort of going by what the last person charged when they were running the practice. We're not selling ourselves short. We know that for a fact. How do you find out how much Medicare is charging? Well, we're going to a single website. We're doing data entry one time, and we're getting Medicare fees for all 89 payment localities in the United States. And oh, by the way, we can save them and instantly recall them because it's the internet, we can save searches. Finally, how do most contract negotiations go, or how should they go? Well, if you had data or some kind of tool like PeakHealth, you would actually have a meaningful back and forth like you would in any other business transaction, where you can talk about numbers, and you can talk about what's reasonable and what's actually the going rate in your area, and you can see, if you're running the practice, whether going to participate with Aetna, say, would actually make sense for you, or whether you're better off not participating with Aetna and seeing their patients on a out-of-network basis. You can actually know whether that would make you money or not make you money at the end of the day. All right, so I know that was a lot of numbers. I'm happy to answer any questions during the Q&A. Thanks for your attention.